Hi, I'm Gavin Giovannoni, Professor of Neurology from the Blizzard Institute at Queen Mary University of London, and I'm joined today by Eyre, who is from the Baker Institute at Rice University. It's a public policy institute. Is that right, Harris?
Yes, exactly, Gavin. Yes.
Maybe we should start off. This podcast is going to be around the brain capital and the brain economy. And maybe we should start off if you could just tell us a little bit about yourself.
Yes, sure. So, first of all, I'm originally Australian, now living in the United States. I am trained as a physician and neuroscientist, but now I spend my time focused purely on the brain economy, and I lead neuropolicy at the Rice University Baker Institute for Public Policy, which is in Houston, Texas. So that's a little bit more about me.
So this particular series of podcasts is really focusing on this issue around brain health. It's the second in our series. And maybe you would maybe you should just start off by explaining to our listeners what you mean by the brain economy, because it's quite a new term to me.
Yeah, absolutely. It is new because myself and colleagues have been developing this. The brain economy is it's a new economic transition. It's a recognition that we need a brain positive economic transition. We need to go from a brain negative position in society, a position in society which is brain unhealthy, where we have too much cost and commonality of mental health and neurological conditions across the lifespan. We have too many challenges that are unaddressed with diagnosis and treatment and prevention. We need to move from that position to a brain positive position where we've managed to sort of bend this escalating $3.5 trillion cost curve of mental and neurological conditions. We've managed to do prevention better, screening, treatment, and diagnosis better, and fundamentally people are living flourishing lives. So that's what the brain economy transition is, and you could think of it as something like the energy transition, where we're moving society from fossil fuel-based energy supplies to clean energy supplies. That's the kind of spirit of the brain economy transition. And the brain economy transition is meant to empower neurologists and brain medicine physicians because they're obviously central to this economic transition.
So when we speak about economics, we normally have this, supply and demand and the metrics of how do you measure it. Is it easy to measure brain capital, as you refer to it? Is it easy to measure?
Yeah, and you mentioned that important point of brain capital. That's a key part of this brain economy transition. We want to think about building brain capital. So this brain negative position is depleting brain capital. Brain positive position is building brain capital. And measurement is critical because if it doesn't get measured, people say it doesn't matter, right? That's very common. So we must invest a lot of time and energy in thinking about how to measure brain capital. And we have developed a global brain capital dashboard. We are doing our best to measure this. This dashboard, which folks can find, they can Google it. It was published through the Brookings Institution, looks at the drivers of brain capital, the determinants, social, economic, digital, environmental determinants. It looks at brain health factors, the presence or absence of disease, and it looks at brain skill factors or cognitive and non-cognitive skills. And so we're working, that dashboard is established, looking at a nation state by nation state level. We want to keep updating that dashboard. We want to try to develop an index so a country has an individual number, maybe out of 100 for their brain capital. So we can start to look at comparative analysis of countries, and we can drive some competitive, healthy competition between countries to try to improve brain capital. But then, as you can imagine, Gavin, just looking at national level brain capital is not enough. We're very passionate about looking at this at multiple scales. So what does this mean perhaps for an individual? There's a whole piece of work around how do you measure an individual's brain capital? What does it mean for a team in a business? What does it mean for a business? What does it mean for a city and for a state or a province? So it's a multi-scale sort of measurement that is needed, and measurement is one of the top 5 priorities that we have through the World Economic Forum's Brain Economy Action Forum. So we we're really very committed to this. And if folks are wanting to collaborate with us, we'd love to talk more about measurement.
So, as a healthcare professional, we kind of understand the concept of what are the drivers of brain health or poor brain health. Now, you're referring to brain skills. So, brain skills is probably something you learn or you acquire. Is that correct? What do you mean by brain skills in the context of the brain economy?
Yes, good question. And so brain capital is defined as brain health plus brain skills. Um, and so that's a key piece to mention. And brain skills are skills which are critical to succeed and really survive in the modern economy. An economy, so brain skills, the top brain skills that we think about at the moment, based on the most recent data from the World Economic Forum's Future Jobs Report, is analytical thinking, creativity, and adaptability. And you can imagine that in the world of artificial intelligence, which is engaging very thoroughly in our world of work, creativity is essential, and this analytical thinking and then adaptability. So that's a bit more about brain skills. And so there are cognitive and then also non-cognitive skills. And that's part of the beauty of brain capital, Gavin, in the brain economy, is that you can tell we're sort of meshing together, we're leaning together the often silos of the health sector, the education sector, and then the labor market as well. So we're creating this kind of new terminology, if you will, and trying to get those sectors to think about a common goal for people, as opposed to the sort of the more siloed traditional approach.
Now, when you speak, I always say there's many stakeholders in this initiative. So let's go to the politicians, the policymakers. Are they engaging with this initiative?
Yes. So this work originally started to engage the senior policymakers, politicians, and senior bureaucrats, and we're delighted that over the last 5 years we have had a lot of engagements. And I'll just try to pick a couple of examples. In the global South context, we recently published the Yaoundé Declaration, which is a declaration developed for Cameroon, the nation state in West Africa, and it's really a roadmap for how to unfold the brain economy in Cameroon and then West Africa more broadly. That was signed by the president of Cameroon, and then also, I think historically, by 32 cabinet ministers in Cameroon. So ministers from across all sectors, because this is an all sectors thing. So that was wonderful, and a testament to a great neurologist, Alfred Namshi, and his team for executing the Yaoundé Declaration. And then, we are engaging with members of the European Parliament, with American congressmen and women, and then also people in the American Senate. So we're trying to make sure we're engaging politicians in the global North and global South, because they obviously have very different issues to contend with when it comes to the brain economy.
So, okay, and now if you move to the healthcare professional, the health sector, now as a neurologist, I'm just going to ask you the blunt question: how do I engage with this on a day-to-day basis when I'm looking after people with different neurological conditions? So we're probably not in the preventative side in neurology. We're reactive to the problem. So maybe you could just give it, because some of the listeners will be healthcare professionals, specialist nurses or neurologists or therapists, and so what can they do for their clients or their patients to promote this concept?
Yes. I would say that sort of brain healthcare professionals, just broadly speaking, neurologists and their ally health staff and psychiatrists and neurosurgeons are I think would say, at the heart of the brain economy transition. This is meant to be empowering to those brain healthcare professionals. I think about it in a couple ways, Gavin, that there's sort of the clinical bucket of things you can do clinically, but then there's also people getting involved more at the public health level, at the engaging with startups, supporting startups that are doing innovative things in diagnosis and treatment. And if I just start, so the startup thing is probably well known to people. People are increasingly familiar with innovation accelerators and such, and have probably met various types of entrepreneurs that are doing brain technology. So just simply engaging with those folks and giving them some friendly guidance about what they are or not doing correctly is one way of engaging with the brain economy. At a public health level, Gavin, I think about organizations like the European Academy of Neurology that's established the Brain Health Mission, which is this continent-wide mission to drive brain health. I think if neurologists out there and other brain specialists can work with EAN and support the Brain Health Mission to be successful in Europe, for example, or if in every national neurology organization has their own equivalent to that. But then at the clinical level, Gavin, which is where most of our work is as physicians, I think it is about how do you use this terminology and see if it helps folks to do better, have better outcomes. Does it help with a little bit of destigmatization? These are new terms. Maybe it can be empowering to people. It can educate and inspire people, or just simply how do you infuse brain health into your clinical practice? And I was struck by a paper recently in the Green Journal of Neurology about the role of a neurologist in brain health. And that was part of the American Academy of Neurology's Brain Health Initiative. And it had so many examples of how you infuse brain health practice into your neurology clinics, whether you're, neuroimmunology, stroke, cognitive disorders, or what have you. So just infusing that in, and that obviously brings prevention. It brings early intervention, and it brings also a strengths-based approach to identifying your patient's brain strengths and sort of spending a little bit more time talking about the positive aspects of what's going on in their situation.
So do you envisage, I'm just thinking, like in the UK, we've got the National Health Service. Would you envisage having, at some point in your life course, having brain health clinics where you go in for screening for modifiable risk factors for poor brain health? I mean, we do have that from a cardiovascular health perspective. We have the well women's clinics that starts. I think mine was at 50, but I think for brain health, we probably would have to do the screening a little bit earlier than 50. But maybe, I don't know.
I think that's a great it's a great innovation and a great goal that we could look at these types of screening clinics and prevention clinics. And I think learning lessons from cardiology is brilliant. Recently, have been fortunate to collaborate with the American Heart Association. They obviously also, the American Stroke Association, have a wonderful chief scientific officer, Mitch Elkin, who's a neurologist, and the American Heart Association is able to explain to us in the brain field how the heart field went from thinking of heart health, or is it thinking of only heart disease? You have a heart attack, it's nearly game over. It's very despondent and despairing. But now they think about heart health. They think about the recovery of the heart after an insult. They think about heart performance and basically heart issues as chronic diseases, for decades and decades. And so in the brain field, we're obviously going on a similar journey, but we're much further behind. We used to think about just disease and how negative it was. Now we're thinking more about brain health and brain performance and thinking about living with conditions for decades and decades. So lessons from heart health, I think, absolutely. What have they done in terms of clinical infrastructure, in terms of screening clinics, in terms of public health and awareness, in terms of registries, and also in terms of, frankly, like precision medicine as well. If we can follow the course of the cardiology field, I think that would be very wise.
Yeah, so I mean, just as a neurologist, some of the low-hanging fruit would be just sorting out population sleep, for example, would be a good way to start off. I think at a population level, we've got major problems with sleep hygiene. I mean, has anybody done anything under your umbrella with trying to sort out the population's poor sleep habits?
I think that's brilliant. I think I totally agree with you. We actually have written about sleep capital as the sort of sleep part of brain capital, and trying to expose how poor sleep can suboptimize your brain capital. It can certainly suboptimize your brain health and your brain skills. So I think it's vital, Gavin. So we're doing our best to raise awareness for it, but I do feel as if the sleep field and the neurology field are still a bit disconnected. So we must do more. And I did note in that paper I mentioned before, the neurology paper on the role of a neurologist in brain health, they did have an entire section on sleep. But this is a question of integrating medical disciplines and raising awareness for the impacts of sleep on the brain. I do agree with you that there's probably so much suboptimized sleep out there, whether it's poor sleep hygiene or mild, moderate sleep apnea that's undiagnosed, that people living with, that's sort of a drain on their brain performance, if you will. So we must do better to try to address that.
Now, have you spoken to the tech industry? Because the tech industry is responsible for quite a lot of the poor sleep hygiene we have. I mean, but they also, I don't know if, most of if you've got a smartphone, both the Android and the Apple have the fitness apps that come with the phone, and they have, you've got to complete these rings, and the daily rings for heart health, essentially. Maybe you as an organization should speak to the tech industry about getting a brain health ring, which would include, sleep hygiene. Because if we're going to raise awareness, we probably should not reinvent wheels that exist, but try and implement brain health through those fitness apps that come with the phones.
Yeah, I have my tracker on here for my heart health, and I really think that it improves my health maybe 10 or 15% just by tracking and measuring. The tech industry is obviously very important, and we need, we are engaging with them, but we need to engage much more. I think the tech is like a Pandora's box that you've just opened, because you can see these benefits of tech, which is things like these wearables, and on social media platforms, they have helped us to raise awareness for, brain health, for example. There are some wonderful influencers with millions of followers that are doing evidence-based brain health awareness raising. But then, as you alluded to, there is this downside of tech as well on our brains. It can be anything from affecting our sleep hygiene, but if you start to think about the real downsides of technology, you start to think about addiction, actual screen addiction, which is particularly problematic for teenagers whose brains haven't yet developed. We know that suicide rates and parasuicidal sort of activities increase with teenage girls with use of social media. And then, of course, we know that artificial intelligence is creating increasing levels of mis and disinformation that's actually quite stressful to people, and then, of course, is responsible for a lot of health disinformation. We see in America the rise of vaccine denialism, for example. So technology, we have to find a way to work with the tech industry to try to tilt them responsibly towards pro brain health activities and products and services, and try to tip them away from the downsides that we're seeing. So it's a really good point to mention to the listeners.
Well, another thing we see in neurology, and I'm sure this applies to general medicine in general, is the anticolinergic burden. As you know, anticolinergics, particularly the CNS penetrant ones, are associated with a higher risk of dementia, falls in the elderly, and all the consequences of them. I mean, that's something I suppose could be done at a policy level as well, as to try and have an initiative to address. Because a lot of the over-the-counter medications people buy, for example, have got quite a high anticholinergic load. So that's another potential in terms of preventative healthcare. A lot of people just aren't aware of anticholinergics.
Yeah, I think you're bringing up another example of what we could call like neuropolicy or neuroscience inspired policy, and I think this is something that maybe we're just scratching the surface on. We need to think about how to deepen neuroscience inspired policy as a field ourselves. The anticholinergic burden piece you're right, and it makes me think the term that comes to my head is brain literacy. So like, how do we measure the current brain literacy of society? And then how do we improve the brain literacy, which we know is not ideal? And we know that we're living amidst this neuroscience renaissance where we have all this new discoveries and findings of neuroscience. But the anticholinergic burden is one example of that. That's obviously an example of a blind spot of brain literacy across the population. So what do we do to boost that? And it's probably policy in terms of raising awareness, but then it's also how do you maybe flag this better with pharmacies and integrate electronic health records with pharmacy systems to alert patients to what they may need to know about, to alert their family, and to, of course, alert their primary care doctors. So I think that is something that we should spend some time thinking about. What would be the policy answer to anticholinergic burden?
Now, I suppose the other thing about the brain economy and brain capital, it probably overlaps a little bit with metabolic health and social health, which some people like to refer to social health. How big is your social capital, your networks and your support systems is being separate. But I would imagine that should fit in under the brain economy, don't you think?
Yeah, absolutely. On the metabolic side, we know that the risk factors for, say, heart disease are essentially the same as the risk factors for brain health. Cardiometabolic risk factors, social capital risk factors, smoking, exercise, sleep. And then, of course, socioeconomically, we also know that equity is a major issue. So folks that are lower socioeconomic status, have higher access and intake of ultra processed foods and higher air pollution exposure. And Agustin Ibanez, between Trinity College London and the Latin American Brain Health Institute, is still doing great work, large scale, looking at the effects of socioeconomics and equity on brain health using these massive data sets. So it's absolute that, and that's why, Gavin, this economy piece is important, because how do you actually fix socioeconomics? Well, it's very hard to fix with our patients just seeing them in the clinic. These are questions of the economy, and so that's why we're interested in working with economists and thinking about how do you actually look across economic sectors and industries at solutions.
So you talk about this big educational piece that underpins your work. Have you managed to get this into any of the medical school or allied medical profession curricula at university yet?
Yes. This work has only been around for about 5 years, so we're still in the early days of it. We are making progress. We have a summer course that we teach at the Global Brain Health Institute, which is between the UCSF School of Medicine and the Trinity College Dublin School of Medicine. So frequently asked to speak to medical schools around the world. So we're working on that. We also just did our first executive education course, which was 4 days of executive education, where we had a number of physicians in the room alongside other types of executives from other industries. So I think this workforce and education around the brain economy is critical. We can do it in just 30-minute intervention, or we can do it across 4 days. And maybe one day we'll end up doing a graduate certificate or a master's degree, or maybe one day they'll end up being PhDs in the brain economy. But slowly, step by step, we'll explore all those things.
Yeah, I mean, I would love to propose it to my medical school to have a module or a special study. Special study modules are the way you get into the curriculum in the long term. They're basically voluntary, so people would choose them that have like a choice of have to do 3 of 10 or something like that, or maybe choose a small start off with designing a special study module around this particular topic. I think it would be a very good topic. My personal opinion is the way to brand this, just the way we are working in the NHS, is under the preventive medicine umbrella, because this is definitely trying to prevent ill health, prevent dementia, prevent poor brain health, and focus on the wellness side of things. So I think that's how I would have to pitch it to my medical school. But I think it should be included in the curriculum. It's such an important topic. And the fact that you're now bringing in the other important stakeholders is critical, including industry. And you've obviously been into companies to talk to employers about this. Do you get positive feedback from the employers?
And I was just going to say, Gavin, on your point about education, maybe we're currently conceptualizing 5 pillars of the brain economy: brain health innovation, brain skill innovation, measurements, investment, and coordination. But maybe we need a 6th, which is, education and workforce. So you've inspired me around that that should be another sort of leg of the stool, if you will. And then to your question about employers, we are very committed to working with employers. We're recognizing that people spend a third of their life in the workplace, and so the workplace is where you get exposed to lots of either good stuff or bad stuff, good behaviors, bad behaviors, good food, bad food, et cetera, et cetera. So actually, colleagues and I have established the Business Collaborative for Brain Health, which folks can Google and find. And that organization is a membership network of big businesses from across sectors, from oil and gas and banking and construction. And we develop tools for them to assess the brain health of their employees and tools to improve the brain health of their employees. And it's important, Gavin, to say that one of the reasons why we've had success with the brain economy and with the workplace is because we're talking about well-being and prevention, but we're also talking about productivity. And ultimately, in this world where we all know that governments are struggling with budget issues and GDP growth and productivity, productivity in the world of work is really key. And so how are we speaking to CEOs and making brain health actually a business priority? Brain health as an asset, brain health as a revenue and a profit driver of businesses is a big part of our narrative in that workforce area.
So I assume there's some startups who are developing, be it tech tools or some kind of innovations to try and promote brain capital and the brain economy.
Yeah, yes, there are. It's remarkable that there are startups in the brain health field. Now there are startups actually using the brain capital and brain economy terminology. People that are looking at different ways of assessing brain health, whether it's with affective computing or whether it's with advanced questionnaires and meshing questionnaire data in a workplace with actual like financial data of that business, and all sorts of different types of technologies that are emerging around the brain economy. And folks will be aware there's digital tools, there's advanced disease modifying drugs, there's diagnostics, there's neurotechnology devices, breakthrough interface. So yes, there's a whole sort of burgeoning field of technology. And what we're trying to do with the brain economy is to try to support that field to be more, hefty and weighty, but obviously with high science. Science and evidence is critical. So that's part of what we're trying to do to foster this industrial sector.
Yeah, so to say to you, I mean, you may or may not be aware, but the NHS has, for example, started paying for subscriptions for certain apps that will fall under this umbrella. There's one around improving sleep. The sleep app actually has been shown to be as effective as CBT-I, which is a special form of CBT for improving sleep, is as effective as using sedatives as well. So, I think the healthcare environment, particularly socialized healthcare systems, are really up for this, because I think it's better than or potentially better than a pharmaceutical solution to certain problems. So this is really exciting. Anyway, I mean, we've come to the end of our half an hour, literally in no time at all. It feels like we've got much more to discuss. So, are there anything I have missed that you want to highlight to the listeners around this?
I would say to folks that if you're interested in engaging, please reach out. I'm available to communicate with folks on LinkedIn or through email. You can find me online. And then if you want to engage more with us, we do have a series of events that are coming up over the next 12 months. Probably best to find them through the World Economic Forum's Brain Economy Action Forum. You'll find that you can Google it, you'll find it. We have an events page. We have events coming up at the UN General Assembly in New York We have folks coming from around the world to that. We have an event in November in Johannesburg as part of the G20, and then the World Economic Forum in January. But anyway, in most corners of the world, we have events and we have collaborators that are very open to working together with folks. So if this has piqued your interest, then just reach out and we'll find a way to weave you into this sort of movement that we have.
Well, it's piqued my interest. So, Harris, thank you very much for joining, and I really appreciate it. And I think maybe we might have to have you back on to go through some, specific case studies to drill down into, where, just to give it, like a real world example where a particular case study has worked across and has been adopted not only by the healthcare system but by the politicians and the educationists as well. So thank you very much.
Wonderful. Thanks, Gavin. I'm glad to come back another time.